Okay, so I'm going to show you how to hopefully manage and stave off plantar fasciitis or any kind of lower leg extremity issues. If you have a spiky roller, this is one of my favorite tools ever. It's got 3 balls here that spin independently, and that allows you to kind of get into your calf. So I know I just said plantar fasciitis, which is the fascia on the bottom of your foot. Usually you feel this tightness or pulling or something like a fire on the bottom of your foot when that gets inflamed. Or the other kind of major injury going on in the foot is Achilles tendonitis, where your pain comes through this big tendon that runs up the back of your foot. In both of those situations, the trouble usually is stemming from a tight calf muscle, right? So we don't have, these things don't really give a whole bunch. They are what they are, but they get tugged on by these muscles up here. And when these muscles get tight, they pull up and they just pull this way and this way. And we wind up with some inflammation and things just getting tugged on, and they don't like it. So what you really want to do is get into, there's 2 major muscles in your calf. You know, like one has the belly of the muscle on the inside and one is going to have the belly on the outside. If you take this spiky roller and you go through here, I'm going to see if I can get it. Like I've got a little bit of an adhesion in the belly over here, and you can kind of see it just kind of go glunk right over that, right there. So I'm going to just get in there and I'm going to go back and forth, and it feels a little sensitive. Maybe in a bruise, I can really feel it. I may not be able to break this up in one session, but if I spend a minute or 2 on it each day, I'll try to break that up. It might have been set up in there for a year before I realized I got to get in there. And maybe some of you haven't realized and maybe struggle with some lower leg stuff and foot stuff. It might be going on for more than a year, right? So that might be set up real good. We have to spend some time, a couple of minutes each night. You can also do on the outside, it's the same thing. You know, you can find if there's something a little bit on the outside. So I'm going to roll in there, and you'll find that I can kind of get the right angle with all of these 3 in there. The other piece of it is your anterior tib. It runs right along your shin here, anterior tibialis, just on the front tibia. And you can also just roll through here, and that is this is kind of what controls that foot flexion of coming up here. So you're just going to roll through there. Just get a little bit of blood flow in there. You do want to be careful. There's a little nerve bundle right out here. Right below that is usually where we get significant pain. So you're just going to kind of roll in there, get some blood flow in there, and loosen that up as well. If you do that in combination with some exercises to strengthen up your calf muscles, hopefully that keeps your feet free of plantar fasciitis and Achilles tendonitis and anything other itis. All right. Have a great one, guys.